Hello dear medicos. Welcome to our YouTube channel Medico Prep. Today our topic is acute laryngotracheobronchitis, also known as CROUP. This respiratory disease often diagnosed in preschool age kids as compared to acute epiglottitis, which is mainly diagnosed in infants and toddlers of 1 to 3 years of age. Infection of larynx and trachea causes the partial or severe obstruction of the airway, which will ultimately leads to breathing difficulties and cough in kids. CROUP also causes a cough that sounds like barking. The symptoms of CROUP are the result of swelling and irritation around the larynx and bronchial tubes. When a cough forces air through this narrowed passageway, the swollen vocal cords produce a noise like a seal barking. The most common cause of the CROUP is infection from parainfluenza virus. Child may get virus by breathing infected respiratory droplets coughed or sneezed into the air. These virus particles may survive on kids' toys and other surfaces as well. The other less common causes includes any allergic reaction, acid reflux, or irritation of the foreign body. These causes usually leads us to diagnosis of bacterial CROUP. The symptoms of CROUP are mostly similar to acute epiglottitis, but barking cough, which usually worsens at night, is the most common feature of CROUP. Other than this, patient may have fever and coryzal symptoms like sneezing and nasal obstruction. The other common clinical feature of CROUP is steeple sign, which can be seen on a X-ray. This steeple sign is produced by presence of edema in trachea, which results in elevation of the tracheal mucosa and loss of the normal shouldering of air column. Significant distress and lethargy can also be seen due to hypoxemia. The diagnosis of CROUP is usually made on the basis of physical examination. If required, then a X-ray can also be done, which will show a typical steeple sign indicating obstruction in the airway. CROUP can be managed with a single dose of oral dexamethasone in all cases. Dexamethasone will given to reduce the swelling of the airway. Symptoms will usually start to improve within few hours. It will be given only in single dose because of its long-lasting effect, but it can be given over several days as well if symptoms don't improve. Prednisolone can also be used as an alternative to dexamethasone, because it also have the same effects as of the dexamethasone. In case of emergency, high-flow oxygen can be given to patient to relieve symptoms of difficulty in breathing. Or patient can be nebulized with adrenaline in severe cases if airway obstruction. For more videos like this, follow and subscribe us. And don't forget to share it with your friend.